Let's see an NCLEX RN video based on care for female patients with reproductive and breast disorders. What is the common gynecological complaint for young women? Dysmenorrhea, endometriosis, uterine cancer, breast cancer. Dysmenorrhea or difficult monthly menses is one of the most common gynecological complaints among younger women. What are considered the greatest risk factors for ovarian cancer? Genetic markers, obesity and unoppressed estrogen, hormone replacement use, diabetes mellitus and hypertension. Obesity and unoppressed estrogen are the greatest risk factors of ovarian cancer. But BRCA1 and BRCA2 gene mutation may also be implicated. Hormone replacement use, diabetes mellitus and hypertension are not implicated to ovarian cancer. Symptoms of menopause include which of the following? Osteoporosis, increased uterine bleeding, vaginal atrophy, hot flushes, abdominal pain. The most common symptoms of menopause are vasomotor symptoms such as hot flushes and vaginal atrophy. Other potential clinical manifestations or complications include bone loss, osteoporosis, increased fracture risk, central weight gain leading to cardiovascular disease, dyslipidemia, and type 2 diabetes mellitus. There is no uterine bleeding and abdominal pain if present is not associated with menopause. So the symptoms of menopause includes osteoporosis, vaginal atrophy and hot flushes. Which of these reproductive cancers is primarily caused by a virus? Breast cancer, cervical cancer, endometrial cancer, ovarian cancer. Cervical cancer is primarily caused by human papillomavirus, a sexually transmitted infection. If the virus is diagnosed early, enough cervical cancer screening is done and is almost entirely preventable. Which procedure can confirm suspected endometriosis? CT scan, ultrasound, MRI, biopsy. Endometriosis occurs when endometrial tissue implants outside of the uterus. Biopsy through laparoscopy must be done to confirm a suspected diagnosis. Ms. Brown has been diagnosed with LCIS, that is lobular carcinoma in situ. The nurse will help Ms. Brown schedule which procedure? Chemotherapy, radiation, mammogram, surgery. So the correct answer is her next mammogram. As LCIS or lobular carcinoma in situ is not considered a precursor for invasive breast cancer and therefore has only continued mammograms are recommended as a follow-up. No surgery, chemotherapy or radiation is recommended. Ms. Green is a 16-year-old who has missed 2 days of school each month this year because of painful menses. She has seen her healthcare provider for treatment. The school nurse is reinforcing the prescribed treatment of oral contraceptives and non-steroidal anti-inflammatory drugs. The nurse teaches Ms. Green to do which of the following? Take her OCPs every other day, that is the oral contraceptive pills. Take the non-steroidal anti-inflammatory drugs at the onset of symptoms and then as needed. Start NSAIDs 2 days prior to menses and continue on schedule until symptoms relieve. Stop the oral contraceptives if she has any vaginal bleeding. Non-steroidal anti-inflammatory drugs should be initiated 2 days prior to her menses and continued on schedule until the symptoms resolve. The patient should not wait until she has symptoms. Oral contraceptives should be taken daily without fail. The nurse is taking care of Miss Davis, a 19-year-old with significant pelvic pain not related to her menstrual cycles. After 6 months of oral contraceptive use and NSAIDs, she has had no relief. The nurse understands the next course of treatment indicated includes narcotics, laparoscopy, hysterectomy, oophorectomy. The next course of action is laparoscopy. This is usually done in outpatient surgery area. Removal of ovaries, oophorectomy, or removal of the uterus, hysterectomy, or narcotics is not indicated at this time. The nurse takes a phone call from Miss Case. Miss Case is 50-year-old and is complaining of lack of menses, the inability to sleep, hot flushes, and fatigue. What condition is the nurse not concerned about? Endometriosis, pregnancy, hypothyroid, menopause. Endometriosis is usually associated with vaginal bleeding. Pregnancy, hypothyroid, and menopause may all present with amenorrhea, fatigue, and hot flushes. 50-year-old women are unlikely to be pregnant, but it is possible and should be considered. Ms. Harris has large uterine fibroids that are causing her pain and heavy bleeding. The nurse is educating her on her treatment options. Which option is considered the only definitive treatment of fibroid? Uterine artery embolization, hysterectomy, Lepron administration, myomectomy. Hysterectomy is the only definitive treatment for fibroids. Uterine artery embolization, Lepron, and myomectomy are also used in the treatment of fibroids but often used in recurrence or incomplete resolution. A nurse working in a clinic has received phone calls from several patients. It's a priority for the nurse to suggest immediate follow-up for the female patient complaining of which of the following: urinary frequency at night, chest discomfort after spicy meals, difficulty eating due to feeling full and bloated, pain with the onset of menses. One of the earliest signs of ovarian cancer is early satiety and bloating. So, if the patient is having difficulty eating due to feeling full and bloated, that should be having a follow-up. Urinary frequency is often seen in urinary tract infection, but it is not specific to nighttime. Chest discomfort triggered by spicy meals is consistent with gastroesophageal reflux disease or GERD. Pain with menses only is usually dysmenorrheal. The most concerning of these complaints is the patient with early satiety and bloating. The nurse is most concerned about Miss James, a 60-year-old female patient, when she calls complaining of which of the following: vaginal itching, a foul vaginal discharge, hot flushes at night, vaginal bleeding. While vaginal itching and discharge are signs of vaginal infection, the most concerning symptom in a post-menopausal woman is vaginal bleeding, as this is often the primary presenting symptom in endometrial cancer. Hot flushes at night are consistent with menopausal symptoms and may be expected in this age group. A 25-year-old patient present to the clinic for her annual gynecological examination. Her last pap smear was at the age of 21. What should she have today? Breast examination, pelvic examination, pap smear. Breast examination, pelvic examination, and pap smear with HPV co-testing. Breast examination, pelvic examination, and HPV testing. Breast and pelvic examinations only. Pap smear should be offered to all women starting at age 21 and then, if normal, repeat every 3 years until the age of 30. HPV is not indicated as a screening for women between the age of 21 and 30. The patient's last PAP was 4 years ago. So, and she is thus due for breast examination, pelvic examination and pap smear. So Ms. Sims, 43-year-old female patient who presents complaining of noticing a knot in her right breast recently in the shower. It is not painful and does not seem to change with position or palpation. She had a mammogram at age 40 that was normal. She takes combination of oral contraceptive pills for birth control and is otherwise in relatively good health. Sims' breast examination reveals a palpable 2 cm mass in the right breast. The mass is not mobile and is non-tender. There are no knots felt in the adnexa or adjacent areas. There is no nipple discharge. The patient is referred for diagnostic mammography and ultrasonography of the palpable mass. Ms. Sims' imaging suggests a lesion suspicious for malignancy. Biopsy of the mass confirms invasive cancer of the right breast. On the basis of imaging, clinical examination and biopsy, it is felt to be a stage 1 breast cancer. Ms. Sims is referred to a breast surgeon, radiation oncologist and medical oncologist for management and treatment. Ms. Sims consults with her physician. Because she is stage 1, she is offered breast conservation versus mastectomy. After careful consideration, she chooses breast conservation. Because her tumor is more than 2 cm, she requires 3 to 6 months of chemotherapy after surgery. Once chemotherapy is complete, she will undergo radiation therapy recommended for all breast conservation patients. Stains of her tumor also reveal that her tumor is estrogen positive. She will take tamoxifen for 5 years. She will require follow-up with mammograms. The nurse at the breast center is educating Ms. Sims on her options. She explains that if she chooses breast conservation therapy, her next step in treatment after surgery will be which of the following: chemotherapy followed by radiation, radiation followed by chemotherapy, chemotherapy and physical therapy, follow-up surgery 6 months later. Stage 1 breast cancer that is treated with breast conservation surgery should then be offered chemotherapy followed by radiation therapy to decrease the recurrence rate and increase the survival rate. So here chemotherapy followed by radiation. The nurse has received a set of orders for Ms. Sims. Which order should the nurse call the provider to verify prior to implementation? Pain medication, oral contraceptives, tamoxifen, stool softener. Any medication containing estrogen would be contraindicated if the breast cancer patient with an estrogen sensitive tumor. Oral contraceptives contain both estrogen and progesterone. Pain medications are safe in breast cancer. Tamoxifen is utilized in the treatment of certain breast cancer. Stool softeners are sometimes necessary when a patient takes pain medication. So here oral contraceptive should be questioned. The nurse taking care of Ms. Sims in the post-operative area should be most concerned about the surgical wound if the assessment include which of the following: bloody drainage saturating the dress, serosanguinous drainage on the dressing, redness under the surgical tape, tenderness at the incision site. Blood drainage saturating the dressing should always be a concern. Serosanguinous drainage in the JP drain is expected. Redness under the surgical tape is likely related to the tape irritation. Tenderness at the incision site is expected. So here we should see for bloody drainage saturating the dressing. The nurse in the postoperative area assesses Ms. Sims for pain. The pain assessment should include which of the following: pain scale, heart rate, extremity pulse check, blood pressure, wound drainage. Pulse and blood pressure. can be greatly affected by pain, and the patient's subjective scale is always the best pain measurement. So pain scale, heart rate and blood pressure should be assessed for pain. Ms. Sims has begun radiation treatments. The nurse in the radiation center monitors Ms. Sims for what important side effect: swelling of the affected arm, opening of the surgical wound, infection of the surgical site, redness, itching and irritation of the radiated skin. The most common side effect of radiation is localized irritation of the radiated skin. So redness, itching and irritation of the radiated skin is the important side effect of radiation treatment. Hope you understood this video. Thank you so much for watching. Please do keep watching the videos.